Welcome, everyone. I am Dr. Catherine Y. Brown, and I am so excited that you have tuned in to meet today's guest, Felicia Seubert. Welcome, Felicia.
Thank you, Dr. Brown, for inviting me. I'm happy to be here.
Thank you. I am so excited that you agreed to have me interview you and for everyone to hear your story and meet you. So I just want to start out by having you share a little bit about your background. Who is Felicia? And tell them where you're joining from, what your location is.
I live in the suburb of the Seattle, Washington area. I was born and raised here, and I'm a mother of a recent college graduate, so I feel very old right now. And I have been a single mother for the last 5 years. So, and a patient. I was diagnosed in 2011 with pulmonary arterial hypertension. It's idiopathic, so it means it's not related to another disease. They don't know why I have it. So that's me.
All right, thank you. So tell us about your PH journey. I mean, just from the time of, diagnosis, what that was like before that, maybe what signs or symptoms, what did you know? How did you seek treatment and what was that route like for you?
Like many of our patients and other fellow pulmonary hypertension patients, I was misdiagnosed probably twice. So I noticed symptoms. I was short of breath, trying to exercise and trying to go on walks. And my initial primary doctor said it's age, which was not pleasant to hear. Hello.
Right? Who wants to hear that?
Age-related asthma, you get older, this is what happens. You have difficulty exercising and so forth. And I just like, really? So after a year of just trying to cope with it, I finally realized when I was having issues when it was on an incline. And at that time, I was under a lot of stress. Mm-hmm. I was a caregiver to my mother, and my child was elementary school age, and I was starting to gain weight, not have energy, and get really tired. And I was having these breathing issues. After a year after being diagnosed with the asthma, age-related asthma, there was a campaign for heart health awareness on television. And they kept saying, short of breath, you have to go get it checked. And I finally went in and got it checked. And I finally told my primary care physician, it's just weird. I said, I'm fine walking around Costco on a flat surface. I can walk no problem without breathing issues. But as soon as I hit a hill, an incline, I have problems. So that started on a series of tests. And in office, she had done one of the breathing tests, and it was inconclusive. So we started on our testing, and I signed up for a cardiac specialty to get a stress test. Mm-hmm. I was supposed to have an echo before my test, and the technician said, we're going to be sending you to the ER. Yeah. So I had the technician started the echo, and as soon as he started, he said, this is I'm afraid I'm going to have to talk to the doctor. Walks out of the room. He says, I think we're going to have to send you to the ER. I'll double check, but in the meantime, I got to check and see if you have a hole in your heart. I'm like, what? That's not good. So we went to the ER, had a CT scan. They couldn't find anything. That I had the echo and it was bad. So the cardiac, when I went back for my second visit with a cardiac physician, the cardiologist, he says he suspects pulmonary hypertension. You don't have blood clot. You don't have this or that. So in the meantime, I had already taken all these respiratory tests too. Yeah, and it was all lining up, and I was scheduled for a right heart catheter. And the wedge, when they did it, my pressures were so high that the wedge, the pressure gauge on the tip of the thing that was supposed to go into my heart wouldn't stay in to get a good reading. It kept popping out. So that was the best measured, best guess is I was over 100, and normal pressures are 30 at even with exercising or under stress. The max pressure in your arterial is 30, and I was over 100, and that was my diagnosis. And that was April of 2011, and I pretty much thought I was gonna die. But yeah, that was, everything on the internet said you were gonna die after 3 years of not having being diagnosed. Right. And I just went into a depression, and it was just horrible. It was just horrible.
What were the treatment options they gave you, and how long did it take for you to get the correct treatment regimen that you needed?
They put me on oral medication. So as bad as my numbers looked, my heart was still in fairly good condition. So, excuse me. And so they started me on oral medication as soon as I got referred to a pulmonary hypertension specialist here in Seattle. Okay. And they step up to the dose with oral medications. And probably 3 to 6 months, I was on the full dose. And it, compared to any of the intravenous type medications, there's really the orals. The fact that I responded well to the orals is just a blessing, I think. And I'm considered a long-term survivor now because it's been over, 11 years, so I'm grateful.
Oh, amazing.
I'm very grateful.
So this is 2022. You were diagnosed in what year?
2011.
What month and year? Is this an anniversary coming up? Are we celebrating?
April 2011.
April 2011. It's just July 2022. So wonderful.
So I'm considered a long-term survivor. And, I was praying that I would live to see my son graduate high school, and now he's graduated college. So this is all icing on a cake for me. My prayers have been answered, and I'm grateful to have be near a specialist. I think that was the key. And I had a good rapport with the doctor. I did my due diligence. There was another pulmonary hypertension doctor in our area. And he just looked at me and says, I can treat you, but I will end up calling him anyway to confer. So you might as well go directly to him. And if you are in need of a lung transplant later on, if that should, if your deterioration occurs, you want to be in the system with the hospital that would be performing the procedure if that should happen. So I pretty much decided who I was going to see as a physician.
Absolutely. Felicia, you said a couple of things that I want to make sure that people hear. A couple of these things, I want to pull it out. You talked about really the importance of media because you saw the commercial, and because of that, you took action. So there is benefit of utilization of dissemination strategies, television, social media, and other things to get awareness out there. You talked about education and also transparency. And what I hear is also authenticity and vulnerability in a provider to say, this provider would be better served to meet your needs than what I would be, because at the end of the day, if I have a question, I'm going to call this person. So you got somebody who was able to refer and take your best interest at heart. And then also I hear this theme of hope, right? Because you say you're a long-term survivor. And I want people to hear that, because sometimes from the time you get the diagnosis to that next doctor's appointment can be terrifying. If you're looking and you say, oh, I only have 3 years left to live and my next appointment is in 6 months. That's traumatic. And I'm not sure that providers understand how traumatic that really is, from the time of diagnosis, the prognosis, and the length of time to the next doctor's visit.
Exactly. I was a basket case. I'll be honest. I was so stressed out. I was so stressed out the day before I saw my pulmonary hypertension specialist the first time, the one who I had chosen to actually treat me. I was in the ER having a panic attack, and I had gone numb on my left side, and I was actually admitted to the hospital for observation, because I had stressed myself so badly that I had a panic attack and my left side of my body had gone numb. So I totally, everyone's journey is different. Everyone's personality is different. So it's very difficult to say, and support system is very different.
Yeah.
So, it's very hard to tell people, how the way you responded is incorrect. There is no correct response, because each person responds to stress and bad news differently. So it's hard to say to tell to doctors, oh, you can be so, you have to be clinical and just treat people without any emotion, because that's your job. You cannot allow your personal vulnerabilities with the patient, because then it could cause your own suffering. So, but to be aware that, yes, there is, everybody told me don't read the internet, but I went ahead anyway.
You're right, it's there. It's there, and it's what you do, right?
You Google it and it's like, oh, all the negative things, and the first treatment is the intravenous stuff, and how hard that would be. Never I imagined until I looked up the Pulmonary Hypertension Association's website that I could follow my own care and understand where my doctor was gonna try out. And thank goodness I could respond to oral medication, but I had a couple of my fellow patients at my support groups that weren't so lucky and had to be on the intravenous. So it is a bigger shock for them. It was much more distressful for them. I mean, they had to quit work. They were considered disabled at that time. And to be on the medication and transition with the medication is much more difficult and much more challenging. And again, if you don't have that support,
right.
I don't know how people do it. At the time I was married, and at the time I had health insurance, and I don't know how other people do it that don't have that.
We don't have it, yeah.
And it's very, luckily, the institution that my pulmonary hypertension specialist is at, they know insurance. They understand our challenges, and they were able to make sure that I had coverage.
Mm-hmm.
And at the time there was no generic, so it was like $3,600 a month. So yeah.
I mean, and I think, Felicia, first, let me say thank you for sharing your story in such an eloquent way, because it gives people the education that they need. That there are some barriers. It can look different. The need for support systems, because you're right. That's the other aspect people don't realize, is how expensive the medication really is. So I want to pivot a little bit, and you can kind of say in that vein, but take me to, we talked about these themes: awareness, empowerment, and hope. So for someone who is watching this and they're listening to you and they're thinking about the cost of medication, how will I do this, or anything at all, what are your words of wisdom that you would give me as I continue this journey, and then also to those who are diagnosed with pulmonary hypertension that are watching this?
There's several different foundations that can assist you with your copays. If you are if you don't have private insurance, state Medicaid, and if you're a certain age, Medicare will assist you. There are, you can ask any pulmonary hypertension support group leader, such as myself, for directions to, for your area, your location by county. We can try to, direct you to different resources to help with copays. But with the healthcare system as it is, with the Medicaid and I don't want to call it Obamacare, but with the, I forget what they call it now officially. I'm having a brain fart, forgive me. But Obamacare, the healthcare, you can purchase healthcare insurance, but if you're not in a financial situation where you can do that, there is Medicare and Medicaid to assist. But there's different routes so that you're not paying. I mean, my medications alone are $100,000 a year, and the copays after insurance are mortgage payment. It's $3,600. There are ways to get that taken care of. And again, at the beginning, I thought, oh my God, we're going to go bankrupt, because I didn't understand that there was assistance out there. Mm-hmm. And at the beginning, before there was any generics, the pharmaceutical companies offered patients aid. So that's another route. So all this information, you have to be an advocate for yourself. That is the hardest thing, is someone to be your advocate or yourself being an advocate. And as a caregiver to my mother, I understood that. So that's the hardest thing to understand when you're in a depression, fearful, just, your brain is going 1,000 miles a minute. What do I do next? I have doctor's appointments. I have to be treated. What does that side effects is treated? Then on top of that, how's that affecting my family life? All that is running through your mind the first year, and you're just like, I'm going to go crazy. Mm-hmm. In the meantime, you're just frightened. And then once the medications start to take effect, which unlike the intravenous, like your mom, it takes a while with the oral medications to see for your body to adjust. And once you start feeling better, then that depression starts lifting and you start thinking a little more straight. and you're not so stressed. And then you lose perspective at some point. Yeah. Everything is exaggerated. Mm-hmm. And you have to come back. And it takes time. You mourn the loss of your old life and what you think your future will be.
Absolutely.
And then and you have to go through that. And then okay, re-examine, readjust to what your goals and future will be. Right. So that takes time. And in the meantime, the physician is just, trying to do their best to Absolutely. Care for you.
Absolutely.
And God bless his staff, his nursing staff and everything. The Pulmonary Hypertension Association was a big help, and the support groups were a big help. And there's a lot of resources out there to assist, but it starts with you. You have to be your advocate. And that's at the beginning when you're misdiagnosed, there's something wrong, there's something wrong, there's something wrong.
Yeah.
It's very hard because you know your own body and no one's listening to you. Right. And luckily for me, I was able to articulate specifically what the difference between, say, an asthma attack versus a pulmonary hypertension symptom, because I was able to walk no problem in a flat surface, but as soon as there was an incline, there was an issue. So that was telling. Yeah. And that started the steps. So I went in to see my primary care physician end of February. I was diagnosed in 2 months. So I went through like every single week I had an appointment. Mm-hmm. And yeah, that's pretty fast, I think, after that.
Absolutely, Felicia, that's pretty fast. And I think the blessing too is that you had the ability, the resources in terms of the transportation, the insurance, the education to go do that, and everybody doesn't. I want to just ask you, as we get ready to close out, is there anything else that you would like to share in closing that I haven't already asked you?
I think for physicians, if you're not, if you're new to pulmonary hypertension, the patients can teach you a lot, because the insidiousness of the disease is that every patient's response to the illness is unique. Mm-hmm. And so there is no cookie cutter. And so I would tell physicians that you need to listen to your patients and be aware that everybody, unfortunately, with this disease responds differently, and be open and listen to what the patient has to say in terms of symptoms, life, and you will learn a lot. The biggest thing is that my physician said to me, he learned the most from his patients, not from the papers, he got most of his education from listening to his patients. So if I were to pass that on to physicians that are entering the field, that's what I would pass on. For patients, don't look at the internet.
Don't do what you did, Felicia.
Yeah. Or at least go to sources like the Pulmonary Hypertension Associations to give you
information that might be relevant.
Information that is current.
Yeah. And keep looking at my podcast from the RWPH awareness group.
Yeah, there you go. That in there. Podcast, yes. Yes, totally. I was such a basket case, and it's okay to be a basket case. Yes. That's not that it. Yes, it's scary, but you'll get through it, and hopefully, patients are afraid to reach out. Yeah. So reach out.
Reach out. I love it. Felicia, thank you so much for being here. Those words of wisdom that you shared about providers, to listen to your patients, listen to them, is so important. And then for patients to continue to advocate. And even if you feel like you don't know how to advocate, keep advocating, right? Keep trying until you can find something, because you made a statement, and I actually wrote it down. How do you advocate for your health when you're going through a depression? And that's something that we don't talk about, but through stories like yours and the journey that I'm on a road to interview 100 people about their pulmonary hypertension journey. So patients, caregivers, medical professionals, and the communities, it's my hope that people will listen to your stories, the oral tradition or oral testimonies, learn something, because it does take an entire community to make a difference.
It does.
Stop talking. We have to keep having this much needed conversation. So, Felicia, thank you. Thank you for your service, for your heart, for your and just for listening to a daughter who wants to give back after her mother is no longer here, because I know she's looking down. So I just appreciate you. And so thank you again, Felicia.
Thank you. You have a wonderful weekend, and God bless you on your journey and your advocacy. I'm so grateful to participate.
Thank you. And for those of you who are watching, you just met the amazing Felicia, who is a survivor, and she's helping other people. So continue to like, share, follow this message, because you're going to meet more amazing people just like Felicia in the days, weeks, months, and hopefully in the years to come. Again, I'm Dr. Catherine Y. Brown, and thank you for watching. Felicia, you are a rock star. Thank you.
Thank you.